Wave therapy. This is the setup of the electrodes in the coplanar position, which means they're on the same aspect of the limb. Prior to setting up the patient for the shortwave therapy, you will of course have checked that the patient had no contraindications, consented them to treatment, positioned them comfortably, exposed the area you want to treat, removing any metal objects. Patient is on a wooden bed, and the patient will have had the skin sensation tested with the test tubes checking that they have good sensation and can recognize heat and cold. This coplanar setup of the electrodes can be used again for acute conditions, perhaps something like shin splints, or for more chronic conditions. So if it was an acute condition, you would be setting the machine up on a pulse setting, keeping the total maximum power less than 5 watts, so therefore not getting any thermal effects. But if it was a chronic condition and you wanted some thermal effects and some warming, then tell your patient what to expect, that you're to expect some warming from the treatment but not too much heat or burning. And then you set it on the continuous mode on the machine and gradually turn up the heat, the intensity, until they can feel a gentle warmth. And this is usually at total peak power between 5 and 11 watts. When setting the patient up in this coplanar position, it's important that the distance between the two electrodes is more than the sum of the skin electrode distance in order to result in better field distribution.